Welcome to our special live broadcast of our Medical Expert Roundtable with local medical experts, our CEO, Jeff Parker, and myself, Lisa Hart. I will be serving as the moderator for today's broadcast. I would first like to introduce Jeff Parker, Village Management Services CEO, who will provide us a background on how this roundtable came to be. Jeff?
Good morning, Lisa, and good morning, residents of Laguna Woods Village. It's a pleasure to be here today to invite and welcome our panel of experts to talk about our reopening plan and what that means with regards to medical advice, getting information from how we can provide a safe environment moving forward and what that entails. So this is about why we're doing it. Is when in communication with not only our residents, but our board of directors and members of our staff, it was important that we communicate fully as much as possible and be as transparent as possible to get information out as how we're opening up the village again now that we can under following state orders, Orange County health orders, and what we believe is the appropriate manner in which we open up our facilities. But a big part of that is reassuring our residents of what is the best health and safety protocol to follow. And so in dialoguing with our board of directors, it became clear that what we could do to help reassure our residents is to put a panel of experts together, bring them in, dialogue with regards to medical questions that we've asked our residents to send in, as well as my opportunity to fully address our PowerPoint presentation that we had sent out to our residents with regards to our future reopening plans. And so welcome everybody. Thank you to the panel for showing up and doing this, and to our residents, I hope you enjoy the program.
Thank you, Jeff. I'd now like to introduce our panel to you. And as you know, Jeff has already spoken, Village Management Services CEO. And then I'd also like to introduce Phyllis Anderson. Now, Phyllis Anderson has a long background, and she is the Chief Operating Officer of Kaiser Foundation Health Plan and Hospitals in Orange County. And since joining Kaiser Permanente in 1992, she has held various healthcare leadership positions. She began her career in the National Health Service in Scotland, where she was trained as a registered nurse and spent some time as a staff nurse and staff leader. She holds a bachelor's degree in health sciences and a master's degree in organizational leadership from Chapman University in Orange, California. She also attended Harvard Business School's Executive Leadership Program. Welcome, Phyllis.
Thank you.
I'd also like to introduce Michelle Park, Dr. Michelle Park, combined trained psychiatrist and family physician, Council on Aging, Kaiser Permanente. In addition to her private practice, Dr. Michelle Park works as a per diem family medicine physician at Kaiser Permanente in Orange County, and as a consultant psychiatrist for the Council on Aging. A graduate of Stanford University and Loma Linda University School of Medicine, Dr. Park completed combined residency in family medicine and psychiatry at the University of California at Davis Medical Center. Dr. Park is board certified in both family medicine and psychiatry. Her professional interests include integration of mental health into primary care and mental health care in emerging adulthood. Welcome.
Thank you for having me.
Our next guest is Adam Solomon, Dr. Adam Solomon, Chief Medical Officer, Memorial Care Medical Foundation. Dr. Solomon is the Chief Medical Officer of the Memorial Care Medical Foundation, providing clinical oversight for both the Memorial Care Medical Group and Greater Newport Physicians Independent Practice Association. After receiving his medical degree from the University of Maryland, Dr. Solomon completed his residency in internal medicine at the University of Utah in Salt Lake City, and then practiced the full spectrum of internal medicine with the Doctor's Clinic in Salem, Oregon for 14 years. He has also completed a master's in medical management at the University of Southern California. Dr. Solomon has become an influential physician voice in Southern California. Welcome.
Thank you. Good morning.
All right. Now that I have introduced the panel, I actually would like to now move to our medical questions, which were all emails that were sent in by our residents. So we will first start with the medical-related questions. And the first one is limited OC COVID testing. There's been a lot of talk about limitations across the country, not just here in Orange County. The first question is, why can you only get coronavirus testing in Orange County if you are 65 and older, and only if you have symptoms versus LA County, where it is available whether or not there are symptoms. Would someone like to start?
Sure, I can start. So I looked at the testing availability at the healthcare agency website just yesterday to assure myself that this is the case, and this is actually not true. So you can get coronavirus testing despite the fact that you don't have symptoms. If you're asymptomatic, there is testing available, specifically at OptumServe sites, and that's available on the website. You can make an appointment. They may be targeting essential groups, essential workers, such as healthcare workers and first responders. However, there is availability, and I will say this is probably specifically for the PCR testing, so the nasal swab, as opposed to the antibody testing that's available for asymptomatic folks. But yes, so it is true that you can get testing. However, there are some questions that you'll have to answer in a brief screening before being able to set up an appointment to go in.
Okay, great. Tom?
And I think it's also important to think about why they may restrict or focus the testing on patients that have symptoms or people that have symptoms versus those that don't. If you're going to do a test, it should impact what you're going to do. Just if you don't have any symptoms, it could be that you are infected, but you have not produced enough virus in your body yet to show positive on the test. So early on in the infection, you may actually have a negative test and yet be infected. And what will you necessarily do differently if you have the test without any symptoms? So those are some considerations we take into why at Memorial Care we've really been testing patients who have symptoms and not those that are asymptomatic.
Okay.
Yes, I agree. That's exactly it. In Kaiser Permanente, we test there is availability for drive-through testing, but it is if you're symptomatic, you do a video visit with your physician, and then we do drive-through testing, but really for the same reasons. It's, if you're symptomatic that you would do the test, and we've done 15,000 tests so far.
Okay, great. Now, this kind of leads into the next question, where the question is, why can't we have drive-up testing here in Laguna Woods? And you just mentioned that Kaiser Permanente has drive-through testing. So what would be the answer to that? And I'll start with you.
Well, I think it would depend on what's available at Laguna Woods to make that happen. At Kaiser Permanente, Orange County, it really took a lot of collaboration with a lot of different teams within the organisation, from engineering, primary care, administration, to really set it up and put everything in place. So, I think first of all it'd be the availability of the testing, itself, and then the setting up of the infrastructure to do that and the coordination. And, I don't know what's available at Laguna Woods to make that happen. But it could be done if all of the infrastructure was there to do it.
Okay, and I would imagine that would be at a very large cost to try and collaborate everybody. What do you say, Jeff?
It is. I just wanted to say, relative to that, we did put in a email to Orange County Health when they started to expand their testing, and they were doing some site testing locations in San Clemente, San Juan Capistrano, and up in Yorba Linda, I believe. And we had put in an email saying, hey, would you want to consider Laguna Woods Village as a possible location where they would set up but we would use maybe the parking lot at one of our larger clubhouses as a location for setting up something like that. At this point in time, they haven't responded as to that being the best location. It's probably a logistics issue more than it is that the village would be a good place to have testing.
Okay, would you like to comment on that?
I'll also mention that Memorial Care has drive-through testing, but it is for Memorial Care, Greater Newport Physicians, Edinger Medical Group patients. And part of that is, again, to determine, does the person have any symptoms that could suggest that they're at higher risk for having an infection with COVID-19? And then there's the follow-up. What do you do once the test comes back? How do you interpret it? And that infrastructure needs to be part of the testing as well.
Yeah.
Yeah, I just wanted to chime in there that it's not just a matter of the testing, as everyone has said. It's a matter of a physician who orders the test, and then a physician or a provider who's able to follow up on the test and provide adequate advice, support, treatment afterwards. And I also just wanted to make sure that to give some context for the testing questions that we're talking about, there is still a testing shortage. shortage, frankly. My husband is a partner at Kaiser, and so Phyllis can speak more to this, but I mean, we hear about the difficulties every week in terms of having sufficient swabs. I mean, there's so many parts to the testing and everyone is trying to test as much as possible, and so there are regularly shortages in terms of the swabs, the solution, the media, and so that's just something that I think we need to keep in mind as we talk about the testing. I think ideally, no one would argue against having widespread available testing for as many of our population as possible. Unfortunately, we're just not there. We don't have the capacity.
Okay. And then moving on to another question where they talk about, and you had sort of alluded to it, how often should we be tested? So you have your initial test, and then you have maybe a follow-up. But what if it comes back positive, and then what would be the testing from there?
So there are a few challenges with doing repeat testing. Once a person is positive, there's a question of now at what point can they go back out and interact? When does their risk of infecting others reduce enough for safety? The CDC has allowed two different ways of clearing, quote unquote, clearing somebody to go out of their isolation. One of them is a symptom-based strategy. The other is a test-based strategy. There's good rationale for both. Initially, they limited the test-based strategy for those that had adequate testing, and that has continued to be a limitation to follow that strategy. The other thing that comes in is that these tests, called a PCR test, is detecting levels of the RNA, the genetic code of the virus, and you can have pieces of that RNA still in the body, still have a positive test, and yet it's not intact genetic code. It doesn't cause an infection. So a person could have a positive test and still no longer be infectious. That has been shown in some cases to go on potentially for weeks. So the clearance of somebody has that potential where they can have a positive test but not be infectious, need another test, need another test. Most of the studies looking at the duration of infectivity seems to be around 9 to 10 days that patients, after they've developed symptoms, that patients are no longer infectious. There aren't large studies enough to say for sure that is the case, but it's felt to be. And so that symptom-based strategy is a reasonable approach. Some people are starting with the symptom-based strategy and then potentially doing a subsequent test to confirm that the patient is negative. But it's not very clear that there's a great rationale to continually test people. If you were testing and someone was negative, again, you could be infected an hour later. Well, then that means you need to get tested the next day. So would we get to a point where everybody's getting tested every day? That would be a very large volume of tests. And we just simply do not have the capacity for that right now.
Okay. Would either one of you like to comment, or you're in agreement?
I agree.
Okay. All right, now the next question does refer a little bit to the PCR method. The question was, which test is best and most accurate, the nose or the mouth swab? But I think, is it one and the same, or are there two different kinds of tests?
So the test that's run is the same for the most part. There are some tests that are out there that don't necessarily do the full PCR. They're more rapid, but most of those accurate tests that are done are PCR tests. And the nose or the throat is just the way of collecting the sample, but the test is run in the same manner. So that's the only difference between the two.
Okay.
I just wanted to add, this is actually a very tricky question in terms of what is the most accurate or the best in terms of the location of the swab. So the PCR tests that we have are very sensitive. There's been a lot of information or misinformation out there about that the tests are not very sensitive because we have a lot of false negatives, or there may be false negatives with various tests. However, the tests are very accurate if you have viral RNA. The trick is figuring out how to get that viral RNA and to have it be accurate if you are infected, and that is part of the issue. So the nasopharyngeal swab, for example, is thought to be very accurate for certain types of patients at a certain point in their infection where there's a lot of viral replication happening in the nasopharynx. However, there is another subset of patients where it's thought that they are having more viral replication in the lungs, in which case a sputum sample would be more effective. And at what point in the testing, for For example, if you've been symptomatic for 10 days, perhaps you're not shedding anymore, even if you did have the virus. And so it becomes a tricky question, and we're still learning a lot more about this virus and the disease process such that we'd be able to target a little bit better. At this point, as I mentioned, because of the testing shortage, we're testing however we can. And so the thing that I also wanted to throw out there is that some of the home testing kits that you may have seen advertised, even I've seen the CVS testing, which is the self-administered nasal swab. Those do have a higher potential for a false negative because the antibody testing is a separate issue, but the nasal swab for yourself, to get a good accurate sample with the most virus or the most potential viral RNA, it does have to be stuck pretty far in there. And so it's very difficult for someone to do it on themselves. So just to keep those things in mind, that I think a professionally within a medical system administered test is probably your best bet, and following medical advice as far as what tests would be best at that point.
Great information. Thank you. All right, we're going to move on to protecting vulnerable populations such as our community. As of Wednesday, June 10th, the Register reported that 161 of 185 Orange County deaths were in the over 55 age groups, with 58 over 85. Now, since Laguna Woods and Laguna Hills contain over 20,000 people over 55, what proactive programs are planned within these cities to test, monitor, and protect these populations that will be under increased risk as regulations are withdrawn? Would you like to start, Phyllis?
So I think, it's the standard precautions that we are all, should all be following for this very vulnerable population. The stay-at-home order was put in place for that reason, staying at home, social distancing, hand hygiene, masking, and I know there's a lot of back and forth about masking, but there are multiple studies that prove masking works. It does work. I'm a proponent of it. I can't say it enough. Have your mask on, stay 6 feet apart, keep doing it. And these are the sort of things that are in place to protect the entire population. Unfortunately, our older population are more vulnerable. I was looking at the statistics for Orange County, and 75% of the population over 65 that's where the deaths have occurred. So really, it's all of these kinds of things for our vulnerable population, and I know it's difficult, but these are the things that we're all having to do, and particularly for this age group. I don't know if our physicians.
I would say just, again, checking back with the healthcare agency's policies, despite the fact that we are moving through various phases of reopening, I believe on the healthcare agency website, they do still recommend sheltering at home if you're over 65 or immunocompromised or have particular vulnerabilities in terms of medical comorbidities and whatnot. I do know that I believe the California Department of Public Health, as a state and as a county healthcare agency, is particularly looking at our nursing home population or nursing facilities, because that is a truly vulnerable population. Just in terms of the statistics as of yesterday, 94 deaths were SNF residents or skilled nursing facility residents, which is almost half of the total deaths within Orange County. And so I know that there is greater surveillance plans. I can't speak to specifics, but I know that they are looking at that particular vulnerable population.
And if you don't mind, the other thing I'd like to address is earlier this week, there was a bit of controversy when a representative from the World Health Organization said that asymptomatic spread was not a meaningful contributor to the spread of this virus. And under further exam and questioning, it actually is that it comes to how they defined asymptomatic. And so many people develop symptoms later. So you start off, you're infected and infectious, and then you later get the symptoms. That pre-symptom time, when people haven't developed the symptoms yet, most people would say they're asymptomatic. They don't have symptoms. When they define that as pre-symptomatic, a little bit of just terminology. And then in addition, they found that a fair number of people that were infectious had very mild symptoms when you actually asked the question. So superficially, they were asymptomatic. They didn't have any major symptoms, but it turns out they did have some minor symptoms, so they were symptomatic. So when you actually look at the detail, people who don't have very significant symptoms or who maybe don't have symptoms yet can easily spread this virus.
All right, thank you. And this leads into the next question. She's 68 years old, and she has comorbidity. She has controlled hypertension, but she otherwise is in excellent health and wants to know what is her percentage of becoming seriously ill. Would anyone like to take that one?
And so the number of people that have been infected with this virus, diagnosed, that are seniors, is actually a small portion of the total number of people that have been infected. But the percentage that have died of the total population that have been infected is the vast majority. They've been the seniors, people over the age of 65. So having that risk of age, having the additional comorbidities that you mentioned, puts you at higher risk if you were to get infected of having a more difficult outcome from the virus. It may not be death, it may be a prolonged hospital stay, but it does increase the risk.
Okay. Anyone else?
I just wanted to add one of the biggest epidemiologic studies that we have out of Wuhan, China. It was based on 44,672 cases, was able to break down by age group mortality risk as well as by specific comorbidities. And so, for example, if you were 60 to 69, there was a 3.6% chance of fatality once you developed the virus or COVID. In your 70s, it was an 8% risk, and in your 80s, it was a 14.8% risk. And this tracks with what we've seen here in Orange County and sort of in the US, that there is obviously a higher risk with your age category. Specific to this particular question, cardiovascular comorbidity conferred a 10.5% increased risk of mortality, and hypertension was 6%. So they didn't do a specific study to talk about what this means in combination. It's not as if they're all additive, but certainly there is a high risk. And I think this is part of what is difficult in this time, is that all of us are individually trying to weigh these risks and trying to figure out how we can live our lives in the safest way possible, while being able to try and be as educated as possible about a novel virus, which we're still learning a lot about.
So, and if you don't mind, if you can indulge me for a second, I wanted to go back. There's a section we didn't talk about on the testing, because those are questions that come up a lot, even within my group, and that's about the difference between the serologic testing, the blood test for antibodies, as compared to the test for the virus itself. We are not doing serology testing on any patients, and the rationale is there's really no value for doing serologic testing on an individual patient. If you're looking at an entire population to try to get an idea how many people appear to have been infected with this virus at some time, you can get some data. But if you do, because after you're infected, it can take 10 to 14 days to start to develop antibodies. Again, just because you have a negative test doesn't mean that you don't have an infection with the virus. In addition, this virus is from a family called the coronavirus, which is a common cause of the common cold, but it's a different type of that coronavirus. There's cross-reactivity between the serology tests for the COVID virus, the virus that causes COVID-19, as well as these coronaviruses. So a positive test may actually be because you had a coronavirus and not this novel coronavirus. And then the other part is that just because you have antibodies doesn't mean they will actually block you from getting infected again. We've seen that people get reinfected with coronaviruses year after year, and so those antibodies don't sustain. So we can't say, well, now you're no longer at risk because you have a positive. We can't say that you're infected because you have a negative. We can't really say much of anything with the serology testing. I know there's a lot of excitement around the serology testing. It's quick, it's readily available. A lot of companies were able to get authorization under an Emergency Use Act by the FDA to get these tests out, and many of them have since been pulled because their accuracy was questionable.
Okay, thank you. All right, I'm going to move on to the next subject, which is actually a little bit, interesting in terms of debatability. COVID is overrated. It's a flu. Previous stats haven't come to pass. So based on that, how many are actually COVID-19 deaths and how many are actually the flu or underlying conditions that would have caused death regardless? I've heard that when elderly in homes die, they are counted as COVID-19 regardless per the acting coroners who are signing the death certificate. Is this true? Who'd like to start?
So I've seen some of the people arguing that this is just the flu. And it is, if you've seen any patients that actually have this virus, it's very clear this is not the flu. Some people have said, well, look, there's 34,000 to 55,000 people that die each year from influenza, and there's, well, now there's double that that have died from COVID-19. But isn't that similar? Well, we've only had 2 million cases of COVID-19 in the United States, and typically there are 35 to 55 million cases of influenza each year in the United States. So the death rate for influenza is 0.1%. From COVID-19, we're talking closer to 5% or so. The recommendations for how to complete a death certificate are also pretty clear. For you to put something down as a cause of death, you have to have good documentation to show that that is the cause of death based on the data that you're collecting, or that you have an extremely high suspicion and can't attribute the death to something else. So people aren't just putting down COVID-19 as a cause of death for a political reason or for any other reason. Mm-hmm. If that is the diagnosis, it's because the person putting down that diagnosis fervently believes that is the reason why that patient passed away from COVID-19.
Okay, perfect. Did you want to add?
I just wanted to add that when I talk about it with my physician colleagues and in physician forums, I think the consensus is that the number of deaths is undercounted. And part of the reason is that when there are folks who pass away in their homes, and it may be from COVID-related complications, but they never got tested, there's no way to say that that person passed away from COVID-related complications because there's no documentation of that. And the family may not order an autopsy to figure out what that was. And so I know as a primary care physician, you have to fill out death certificates for your patients. And oftentimes, it is a difficult thing to figure out, well, these are the comorbidities that my patient had, and this is what I think happened, and so you put that down. But I know from a primary care perspective, you would not be able to put down COVID if it wasn't there, if you don't have the documentation to show that. So I'm much more concerned when we look at studies of the looking at the population at large in the US, the excess deaths, the excess mortalities that happen over the past 6 months. There is a lot, and we don't know how much to attribute to COVID, but it's certainly higher than the stated number of deaths that we have, which is based on a specific diagnosis and testing that was done. So for what that's worth.
The other thing to remember is when we talk about COVID versus flu or COVID and flu, I agree with everything both of our physicians have said, but we have a vaccine for flu and we have treatment for flu. We don't yet we have some treatment for COVID, that's being used in our hospitals, but we don't have a vaccine. So it's very different in that respect. The other thing is we widely vaccinate our population for flu. So let's hope everybody's going to get vaccinated this year. So that's a difference as well, as well as the mortality being hugely higher.
Right, okay, thank you.
And the other thing I mentioned is the infectivity of this virus compared to influenza. So there's a value that they use called R0, and it's the number of people that get infected by someone who has an infection. And for the flu, it's about 1.3. So just more than one other person would be infected by someone who has influenza. This virus, when it started off before all the social distancing took root, our rates were going up with an R0 of between 2 and 3, in some locations faster. So for every person that had an infection, they were infecting 2 to 3 other people, probably around 2.3, 2.4, would get infected by this virus. The speed with which this was progressing in the community was more than double what the speed would be from influenza. Mm-hmm. The reason we ultimately didn't see the numbers of infections that we would expect to see from the flu is directly related to all of the social distancing, the masking, the hand hygiene, all of the things that we've implemented, those are the reasons why that curve was flattened, and it's still not necessarily coming down. It's still going up, actually, in some areas of the country, including Orange County. And I would relate this to saying the same as, well, why are we doing all those security checks on airplanes before you take off? When's the last time there was an airplane crash? We shouldn't do any of that. And the idea is to prevent tragedy from occurring.
All right, thank you. You did mention about reopening, so obviously there are many things that are starting to reopen. We have restaurants where you can sit down now and dine. There are places like bars that are going to be opening, allowing lots of people in, and not necessarily requiring a mask. And the next question does refer to wearing a mask. What is the current OC mandate for wearing face masks outside, and should I wear a mask outside? Who would like to start? Okay, we're gonna go with you, Michelle.
Sure. So if you've been following the news, the guidance for this from the healthcare agency has very recently changed from a mandate to a strong recommendation. Although Dr. Chow made it very clear that this is not due to a change in the evidence behind mask wearing, but just to become more closely aligned with what the state is putting out in terms of the California Department of Public Health. And this is true because we have different policies in different counties. San Diego and LA County still has a mask mandate in place, and whereas Riverside and San Bernardino do not. So that is, from what my understanding as of yesterday night, what the Orange County Healthcare Agency recommendation is a strong recommendation for everyone to be wearing masks. Should you wear a mask outside? Yes. I think it's as simple as that. From a physician perspective, and Phyllis mentioned this, there are increasing studies because we are very interested in this. How much does mask wearing make a difference? There was a study that was just published 2 days ago, I believe, which was a modeling study that found that the R0, what Dr. Solomon just referred to in terms of the infectivity, that universal mask wearing for everyone to wear a mask, even if it is a very flimsy mask that only prevents 50% of the droplets from escaping, that decreases the R0 below or down closer to 1 or below 1, which means that we have a better chance of being able to contain the infection. Right now, we're in a phase where we are not at a point of containment. We're in a strategy called mitigation, which is that it's spreading in our community, unfortunately, and unfortunately, unlike other countries, which were able to do greater testing up front, greater contact tracing up front, for example, like New Zealand, which hasn't had any cases, we're not at that point in our community, and so we're at the point of really trying to decrease the amount of infection that unfortunately is continuing to happen to the point where we can decrease the R0 below 1 to the point where we can get to containment. That's our goal. That's the public health goal.
I'm glad that you mentioned doesn't matter what kind of mask, because there are all kinds of masks, and you're basically saying that it really doesn't matter what you have over your mouth as long as it is preventing at least 50%. How would they know? How would someone know about the mask, like in which one to wear that could generally keep out about 50% of the droplets? How would they know?
I believe that there was just WHO guidance about what type of non-medical mask would be helpful. This is something that's an ongoing field of study, frankly, so we're still trying to figure this out. I believe that the WHO recommendation was a 3-layer mask, and one of them with different materials. Most of the fabric masks that I know, that I've seen, frankly, that medical professionals have been resorting to because there is still a shortage of respirator masks and surgical masks. The ones that physicians are using are triple layers. So there's a double ply fabric with some sort of filter in between. Right. I will say personally, myself, I created filters and used cloth masks. I created filters from air filters. So I got the highest rated HEPA filter that I could find and cut them up and use them as filters. I know other people are using coffee filters. People can use vacuum bags. There's a lot of different ways to do this. Again, And I don't think the modeling study is meant to sort of scare people into thinking like, well, now I need to know what percent of droplets my particular mask is preventing. I think the point is that everyone should wear a mask. That helps to protect you, that helps to protect others. And the type of mask is, open to discussion in terms of what is the most effective, but any sort of face covering is better than none.
Okay, fantastic. Anyone else?
I'd like to just mention the main reason for everyone to be masked is not necessarily for them to protect themselves. Wearing a mask is actually to protect everyone else from you potentially spreading the virus. Everyone is doing something for each other. This is for the community. I'd rather have somebody wear a mask than that may not be triple layered and worry about all that, but to wear the mask, it will help. Probably, if I was going to say there are certain things to look for that would not be a great mask, is those that have some sort of one-way valve that allows you to breathe out, and so your air goes straight through the mask to filter things from coming in. That just took away the whole value of having that protection from the droplets coming out of you. You're breathing through the mask because it has an opening. There's not much value to that for others.
All right, excellent information. Yes?
So my answer is yes, you should wear a mask, and I wholeheartedly agree. This is a community effort. It's not about you, it's not about me, it's about all of us, protecting each other. And I personally, when I'm out and I see people without masks, it really upsets me. I think it's such I feel like it's such a selfish thing to be out there not wearing a mask. I think we really need to be looking after each other. And I would say, particularly in your community here, when you do have, people over 65, maybe with other health issues, it's something you definitely should do.
Excellent. And so I think most of your answers have covered the majority of the questions regarding masks, with the exception of the last one. Should I wear a mask while driving? I see a lot of people that put their masks on, and then there's some people go, oh, no. You're fidgeting too much with your mask, and it's going to cause a problem. What are your comments on that?
So again, the main point of the mask is to protect others from getting an infection. If you're in the car by yourself, there's no one in your car to infect. You don't need to wear a mask.
Right.
If you're in a car with other people that you live with, so you're exposed to them all the time without masks, it doesn't make sense for people in the car to be wearing a mask. But if for some reason you're in this enclosed space of a vehicle with other people, everyone should be masked. The risk for transmission actually is greater if you're in an enclosed space. And I want to probably address one other thing that some of you are probably thinking, well, we're looking at you and you're not wearing a mask and you're with other people. Part of that is the social distancing. The rationale for the mask is there are times where you're not going to know when you're going to be near somebody else. The spread is very related to how close you are to other people. And so if you know you will be in a space with adequate distancing from somebody else, especially if it's in an open area, the risks of transmission are lower. It's not always worth making that determination, and so it's always safer to defer to or default to wearing the mask. But if you are out on a trail walking by yourself with no one around, you could probably take a mask off.
Right.
I just also wanted to add, we did all bring our masks.
Yes.
Yeah.
Yes, we did.
We all
brought
masks.
ours.
And I also wanted to address some of the other questions. I would say the one caveat I will say to wearing a mask in the car, one of the questions that we received was what's the proper way to put on and off masks, and how to properly wear them. So my caveat would be this is very important since we see a lot of folks out there who are not necessarily using the masks appropriately. So number one, to be effective, it needs to cover both the nose and the mouth. So wearing the mask underneath your nose is not very helpful. If you sneeze, those droplets are going everywhere. So the point is to try to keep the droplets in, as well as from a protective standpoint, you're not being protected because then you could breathe in the aerosols or droplets that other people have put out. And the caveat I would say in terms of the car, so putting on and off the mask is a tricky thing. If you're out there in the grocery store, for example, going out grocery shopping, The risk of getting yourself infected from surface transmission or fomites, from what we've learned over the past couple months, is very low. The primary means of transmission is respiratory for this virus. So that being said, we want to decrease the risk as much as possible. So if you were to wear your mask, and this is true in the hospital, any kind of, if you're using it in surgery, if you're using it in the outpatient clinic, the way that you wear the mask, the principle is all the same, which is try not to touch the front of the mask. So you think of the front of the mask as being contaminated potentially with other people's droplets, other things. And so when you remove your mask, the idea is to try to remove it from the back. So from your ear loops or from the back if you're wearing it. Now this can be tricky when you're out and about and maybe going to different places. So if you are going to multiple different stops, let's say I'm going to go to the post office and then going to the grocery store, maybe I'm not going to take off my mask because that increases the chances of me fiddling with the mask, potentially having it on my hand, not putting hand sanitizer on, and then inhaling it or putting it in my eye. So that's the other thing, means of transmission, is that we know that the eyes are potentially vulnerable, and so the masks are also helpful for not touching your face. So if you are going to go to multiple different stops, for example, it makes sense for you to keep the mask on in the car. It's not necessarily to protect other people, but just to prevent yourself from touching your face as well as fiddling with the mask more than you need to.
Okay, fantastic. Thank you very much. We've discussed on this day many times with our doctors and folks from various hospitals about returning to the hospital for heart attack, stroke, procedures, elective surgeries. But the fear is very, very strong. People are afraid, especially our community. So the question is, what are my chances of becoming infected or exposed at a doctor's office or hospital? What protocols are hospitals and doctors' offices using to disinfect spaces where sick people congregate? If I need a surgery or procedure done, will I be safe? Who'd like to start?
Yeah.
So, I'd say you're probably less likely to get coronavirus in a hospital or doctor's office than maybe you are in the community because of all of the measures that are put in place. So in our hospitals, we have temperature screening before you come into the hospital. Mm-hmm. We have everyone wearing masks. We have social distancing for staff and all of the people that are within the hospital. For patients and visitors, there's markings to make sure people are staying socially distant. All of our waiting rooms are set up in such a way to allow for social distancing. There's the usual, which there is year-round, all of the hand sanitizers throughout all of our buildings, as well as all of the cleaning, the increased cleaning and disinfection of the hospital and clinic spaces. We're in the process of actually reopening some of our clinics. We never stopped caring for patients. We were able to, in Kaiser Permanente, do 90% virtual visits so that all of our members continued to get care. Many of whom didn't want to come in, because of the risk. So now we're reopening, and there's a huge checklist that we're having to go through step by step with every facility as we reopen to make sure all of the things that are in place, cleanliness-wise and distancing-wise, to protect both our staff and our patients. I would also say that during the coronavirus time, we did have patients who stayed away that probably should have come in, in the community, with maybe a heart condition, weren't coming to our ER. So I would say, as you normally would, if you have, a medical condition that you feel you need to see a physician for, you should seek care, because we don't want people getting sick outside, dying at home that have a heart attack because they don't want to come into an emergency room. So continue to seek care. All of our hospitals are really very well protected, and I'm sure our medical experts would say the same.
Yes, absolutely. At this point, it's very safe to come into the office to see your physician, or if you need to be hospitalized, either because of an elective surgery or because you need to go to the emergency department, your risk of getting infected from any of those locations is much, much lower than it would be out in the community or in your grocery store.
Yeah.
Okay. Great, thank you very much. Now, before I move into our operations-related questions, Jeff, you wanted to sort of give an overview of the reopening plan?
Thank you, Lisa. On the screen, I just wanted to indicate that, let's get my microphone on, that in listening to the doctors and the advice has been something that we have followed very closely to make sure that when we've been evaluating our reopening plan, that we've taken this type of information and the importance of wearing masks, the importance of how to be safe out there, along with the directives from, like I said, Orange County Health and from the state and from the CDC. Those combined pieces of information of what has allowed us to come up with this plan and move forward. One thing I wanted to make sure that our residents know is that internally in our organization, our key staff people, especially any individual that's working on a manor or working in a manor, is using PPE, so they're protected, so that the individual who's allowing them to come into their manor understand that protection and that level of protection is there, so they don't have as much of a worry. On the screen is our reopening plan. It follows very much in line with the state's 4 phases. This is referencing our facilities, amenities, ones that we've already opened. Most of the people know in our community, golf courses, our driving range, tennis, pickleball, paddle tennis. These are operations that are already open. I just mentioned this morning on TV6 that with regards to tennis, we are now moving into the next phase, allowing doubles, and we are continually looking at pickleball and paddle tennis as far as doubles coming down in the near future. We follow not only national associations for this information, but again, the guidelines from the state and local. Starting in June, we had the additional layout of our lawn bowling operations and some of our outdoor fitness programs. And probably one of the biggest ones that we get, besides tennis, we oftentimes get emails about our pools. When are their pools going? Well, just so happens that same order that came out yesterday from Orange County is, and following the state, is that community HOA pools are now allowed to be open. So the good news is that we have been working on our protocol. It's basically almost in place, and so now we are looking at how are we going to restaff our pools, how are we going to create that social distancing and the requirements that are necessary to meet the state guidelines. We're setting that all up. I'm hoping to be able to announce that early next week, with potentially the pools opening at the end of the week or early the following week after that. So that's real exciting news, because I know a lot of people want to get back into our pools. Going forward into July and then in August, we are looking at expanding our outdoor fitness classes. And then when we get into August, we are really talking about the social engagement where we open our clubhouses again. The issue there obviously is social distancing at its most critical nature. We have organizations that are have groups as big as 100, 200, 300 people in attendance, so that social distancing is problematic, because that hasn't been allowed under the state guidelines. So we will, important that we follow those state guidelines. As soon as those are available to us to move forward on, we will put our guidelines together in the village and we will go there. The second one on the reopening plan that's up on the screen now is our services, things that we do operationalize for the village. The first one's the green. This is operations that we're already in, and many of these operations never closed down. Our employees have worked remotely, so that we don't have as many employees here at the community center, but such as finance and our landscaping and our operations and administration, that's not stopped. We've been going, and we will continue to move forward. What's different is, as we moved into now the month of June, we are starting to fully operate back up our manor alterations and those working with our real estate operations. So there are a number of units out there that need repair, They've made their submittals into resident services. So we're gearing up, getting our staff fully in place. And when we have that, we will be fully in operation in those categories. Our security, our transportation programs continues to flow. One of the things that I appreciate, the mass things that we did when we closed the facilities, number one was following the model from the state. And we went in and did all the deep cleaning that was necessary. With our transportation program that we thought was still essential, we have required individuals to wear a mask in order to ride our transportation system. We have also done social distancing on those buses as much as possible. Now that things are opening up again, our commercial routes are becoming more interested and people want to go out and shop and stuff like that. And we will be evaluating, making sure, again, the masks are worn and how we can address the social distancing on our transportation programs. So as we open up, I want to assure the residents that we're doing it from a very cautious, very protective for their protection, not just our employees, but for their protection. I think that's the one thing I'm hearing clearly is wearing masks isn't just about you, it's really about other people. And our operations are about your safety, not just our safety and our employees. Again, just real quickly, talking about in our next phase, opening up our, getting our plumbing and renovation operations back, our electrical teams back. One of the things that we have to do is make sure that we are following the guidelines necessary. Used to be that our 30 electricians would come in the morning and all gather and get their tools and not wearing masks and would be real close to each other. So now we got to create that social distancing. We want to make sure their lunch break areas are appropriate. So that is a requirement and something that we're doing. So as we bring our employees back, we'll make sure that those are in place before they come back. And then finally, I want to talk about some of the ones that are out there in the future. Bulky item pickup and our carport cleaning. Those are, again, not considered essential services, so we'll bring those. The bulky item pickup, by the way, is our contract waste management, and because of the social distancing in the vehicle, they stopped doing that, and that's why we had put a hold on that pickup. And again, looking at prior to paint and painting programs, we're trying to get confirmation from the state whether or not those programs can come back at this point in time. And then once they do, we'll get them in operation and being in a manner that is safe, not only for our employees, but especially for the community.
And you come back to that regularly for not only for yourselves, but for the community and the staff. And I'd like to jump actually to a general freedom question, because I think that kind of falls in line with what he's trying to do or what they're trying to do. So why do you feel it necessary to make decisions about my personal safety, personal choice and freedom before safety? So in your opinion, Dr. Solomon, how do you support the way that we are reopening our community?
It sounds like there's a very appropriate, conscientious reopening plan. Again, the goal of this is to help prevent the spread within the community to others. When I started practicing, one of the reasons I got a flu shot every year was not so that I didn't get the flu, it was so that I didn't kill one of my patients by giving them the flu. This is a community effort. We're all part of a community. We do need to look out for each other. Maybe this isn't the best analogy, but you can say, well, I should be able to do what I want because it's my life. I could drink and drive. It's my problem if it hurts me. We have to think about the community and the other people that could be affected. And I think this is a very rational program, and being thoughtful of everyone that's in the community and listening to the guidelines that are available from the different experts is the appropriate way to go.
Yeah.
Okay, great. Michelle?
I just wanted to acknowledge a sense that I have from reading some of these questions about restriction of freedom or whatnot. And I think something that's really important to acknowledge is that this pandemic has caused all of us to be really stressed out. It's causing stress. We're getting more data now about the mental health impact of COVID on all of us, and it's not good. There are increased rates of anxiety and depression. The polls that I've seen in studies show that more than half of Americans have felt that their mental health has suffered as a result of the pandemic, and that applies to every single person here, all of our different institutions. Everyone is trying to do the best that we can in this situation. That being said, I understand the frustration and anxiety and anger of our residents here, as well as many of us out in the community who would like to be able to engage in the activities that are important for our physical health, for our mental health, and as soon as possible. And I don't think that anyone would argue that that is not the goal. I think it's important to understand that everyone's goal is the same in terms of being able to have everyone sort of pursue the same activities, the same engagement with others as soon as possible. Unfortunately, this is a once-in-a-lifetime pandemic, and we're still learning so much about it. And so I just wanted to make sure that we're conscientious of the fact that I think we know from a medical perspective that this pandemic is causing a lot of obviously physical like actual death and disability and morbidity for folks who have contracted the virus and contracted COVID, but it's impacted all of us negatively in that way. And the reason why I think we keep emphasizing a community perspective is that that's the only way that we get through this, frankly, together, and that it has to be a public health approach because this is something that has shut down the entire world, that it is, in this case, very important for us to have as much data and science driving the decisions for a community as possible, without infringing individual freedoms to the extent to which possible. No one wants to take away these freedoms, but it's a matter of trying to make sure that a community is safe. And I just wanted to say it's also about keeping healthcare workers safe. Because it's something that I think about all the time in terms of my friends and colleagues and family who are working in the hospitals and clinics, all the nurses and staff, everyone who's in these facilities. We're essential workers and we have to go to work, and it's our pleasure to do so. It's scary sometimes and can be really frustrating, particularly when we see people in the community who are not taking this virus seriously and not just posing a risk to themselves and their family and their communities, but also to healthcare workers if you were to become sick or if the people that you infect become very ill and have to come into the hospital.
I want to applaud Laguna Woods Village for getting this far and everything you put in place, because it shows in your numbers of people infected in your community. I know it's difficult, but everyone, believe me, I wanted to get right back out there shopping, and it's killing me, but it's hard, and particularly for this community, it's hard. I think your plan is excellent. I mean, as I was listening to you, you're following all the guidelines, many of the things just like we would do in the hospital, so I think it is about the community. I think just bear with it. It looks like the sun is coming up. There's things starting to open. We're going to get through this together. But we need to just stay the course, and there are plans, and I hope that reassured all of the residents that there are clear plans so that you can see the light at the end of the tunnel when all the different things that you so enjoy and are really fortunate to have here, when they're all going to open. And before we know it, this will be behind all of us and we'll be out there and enjoying life. But just bear with it. This is an excellent plan.
Thank you very much. There's one last question that I wanted to read from operations, because it is sort of operations medical, and it has to do with opening of the pools. The questions really relies, it's safe to swim in our pools. Is it true that chlorine water kills the virus? And if that's the truth, then why can't I swim? So who would like to start with that one?
Well, according to the CDC, there's no current evidence of spread by pools, which is why I think we're getting more guidelines that pools can be open. I've seen a study on chlorine for the SARS coronavirus, so not this novel coronavirus, but that certain types of chlorine did deactivate the virus. And so we're fairly certain that being in the pool, even if there was to be someone who was infected, that you're not necessarily going to get it from being in the same pool. pool. I think my concern is more, how do you make sure that that you are able to maintain social distancing, and also the bathrooms, the facilities around the pool. We do know that there is live virus and and RNA in. There's fecal transmission of that. There's no cases that I'm aware of. It's not a large proportion in terms of fecal transmission of coronavirus. However, that's definitely something to keep in mind in terms of being safe in the bathrooms with the toilets flushing and whatnot. And so I think, and especially in the forums that I've read in terms of physician colleagues, everyone wants to get to the pool. Everyone wants to get their kids to the pool. Everyone wants to be able to enjoy it. But the question is just how to do it safely. I don't think it's about the pool safety as much as the chairs around the pool, how many people are going in and out of the locker rooms. Those are things to think through really thoughtfully and carefully.
Okay.
And I support the biggest risk in the pool is the social distancing. When people are active, they breathe more heavily, and so that distance that virus can go is a little bit further, and it's very difficult to have a mask on when you're in the pool. It's going to get wet, or you're not going to wear it. And so being able to maintain that distance between people to make sure that they're not infecting others through the air is the greater risk than worrying about an infection from the water. Yeah.
All right. I now would like we're pretty much done with the questions. And so I would like to have each of you just sort of give a wrap-up comment, and then we'll have Jeff wrap it up. So, Dr. Solomon?
I'm sure. First of all, I just want to thank you all for inviting me today. It's been my pleasure to come and participate and answer these excellent questions from the residents here. It's been good. I also applaud you for the very rational way that you're opening up. I echo the remarks about it's very frustrating. People have been cooped up for quite some time, and it is causing an increase in stress. It is important for us to just think about others and how we treat others, because we do want to be treated well ourselves, regardless of how bad of a day that somebody is having, or a month or a few months that somebody's been having. But things are starting to open up. We do understand more about this virus than we did a few months ago. We understand more about the transmission, about the risks, but we definitely do not know everything. We've also been hampered by this very slow availability of testing, and so there are challenges that are related to that. And there is some continued risk with seeing the number of cases continue to go up in Orange County. That is a bit concerning. And not because of more testing. You actually see more hospitalizations. You can't increase hospitalizations just because you're testing more. You'd only admit patients into the hospital because they are sick enough to be in a hospital. So that's still there as a cause for concern. And I applaud the organization here for the highest risk population having such a low incidence. Really is a testament to the work and conscientious efforts that have been made here. So thank you very much.
Thank you. Michelle?
So I'm here as a representative of Council on Aging, and so I just wanted to encourage everyone to look at our organization for support. The COVID stress that I mentioned is very real. Social isolation is a known risk factor for our mental and physical health, and so this has been a really, and will continue to be a really trying time. However, I have many different colleagues at the Council on Aging who have continued to work through this time to support our older adults in various different ways. I personally work with the Reconnect program, which provides a year's worth of case management, up to a year's worth of case management to try to prevent mental illness and to try to support our older adults to the extent to which possible. And we've definitely had to get creative during this time to try to support people. A lot of telephone calls and video visits where possible. But I just wanted to say thank you for having me, and also that there are many, many resources available for your support here. And just to echo what everyone is saying, I think we want to try to keep our older adult population as safe as possible, obviously, because we value our older adult population. And it's really important. I know that there have been some elected officials who have said things that indicate that somehow that older adults have lived their life, or that they, that their life is somehow perhaps less important or valuable, that their health and safety is less important or valuable than the general population or the younger generations. And I just wanted to emphasize that that is obviously not the case, which is why we are taking such caution with opening up.
Thank you.
So thank you. I just want to say thank you for inviting me to be here. Some very, very thoughtful questions. I really appreciate being part of this and look forward to answering more questions. If you have any more questions, I hope you got something out of it today. The message is just follow the guidelines. Laguna Woods Village has done a fantastic job. And as I said, there is a light at the end of the tunnel. Although we are seeing cases, hospitalizations in Orange County increase, we just need to, as I said, stay the course, keep going, follow the guidelines, and we're all going to get there together, and take care of each other.
Thank you. Thank you, Jeff.
Well, a couple things. First of all, I want to thank Adam, Michelle, and Phyllis. Just an excellent job, and I appreciate you so much coming today and being part of this panel. I think it educates our community even more, and I think that's what we were here to do today. I want to have a thank you to our residents. It was stated how incredible they've done in a sense of keeping our numbers so low. We are one of the lowest in the county as far as communities, but when you take into consideration that our age group, it's pretty phenomenal that our rates are so low. So kudos to our residents for being careful about themselves and being careful about their neighbors. I'd like to personally thank the communication team for putting this on. Lisa for being the host. Thank you so much. And finally, I want to thank our board of directors from GRF, United, and Third for having the insight that putting a panel together with our reopening plan was something that our community would appreciate. So kudos to everybody, and thank you.
All right, thank you, everyone. I wanted to remind those that are watching that you can watch this rebroadcasted on Tuesday, June 16th at 2 p.m., Thursday, June 18th at 5:30, Tuesday, June 23rd at 9:30, and Tuesday, June 30th at 5:30. And then, of course, you can always see it on our YouTube channel, which is lagunawoodsvillage.com/YouTube. Thank you all for joining us. We appreciate it, and we hope that these answers have helped many of your questions that you have had, or maybe have you thinking about things that you might have not thought about before. And obviously, the reopening is with careful thought. Thank you for joining us.